would like to welcome Dr. Adelaide Hebert, Professor and Director of Pediatric Dermatology at McGovern Medical School at UT Health in Houston. Thank you so much for being with us. What are the major components of CLn BodyWash? How does this differ from similar treatments?
Well, the key ingredient that we really focus on in dermatology is the sodium hypochlorite, 0.006%. And this is the ingredient that really impacts the skin in patients suffering with atopic dermatitis or other superficial infections or colonization states in the realm of dermatologic diseases. This ingredient is one that really remedies the colonization and renders the patient improved with their overall status. At least that's what we found in our study on moderate to severe atopic dermatitis patients within the pediatric realm.
CLn BodyWash was recently investigated in a clinical trial. Can you elaborate more on the details of the patient selection process, safety, and efficacy? And what were the end results of this study?
I'm happy to do that. I was very fortunate to collaborate with my colleague and friend Amy Peller at Northwestern University to involve two institutions that have pediatric dermatology clinics that are actively enrolling patients in clinical trials. In this particular study, we enrolled patients ranging in age from 6 months to 17 years who had moderate to severe atopic dermatitis. These patients could not have recently been on an oral antibiotic and could not have used dilute bleach baths in the 2 weeks prior to eligibility for enrollment. They had to have, again, moderate to severe atopic dermatitis to be considered eligible. Cultures were performed, but these were not quantitative cultures. And PCR was also performed on skin swabs taken from the skin surface of these patients. They were asked to bathe daily with CLn Wash, applying it, leaving it on the skin 1 to 2 minutes, then rinsing it off. And our outcomes were really quite successful in that so many parameters improved over the 6-week clinical trial period. These patients may not have had complete resolution of the Staph aureus on their skin, but their EASI scores went down at 2 weeks, 6 weeks, and at the final visit in the clinical trial itself. We were very excited with these outcomes. Also, it was also noted by the parents or the patients that they actually preferred CLn Wash to the dilute bleach bath for those patients who indeed had used the dilute bleach bath experience prior to being enrolled in our clinical trial. These outcomes, I think, are remarkable, but if one is really interested in seeing some of the clinical photographs of the patients enrolled in these trials, they can go to the TopMD website, look under the physician portal, and you will see additional slides outlining our clinical trial, the outcomes, the parameters used during the clinical trial, and clinical photographs of patients who actually participated successfully in this open label trial using CLn Wash daily for bathing over a 6-week period.
Can you also elaborate on the clinical benefits of CLn BodyWash that were observed in the study?
Well, one of the things that really resonated with patients was the fact that some patients just don't like to take a bath. I mean, we enrolled patients up to 17 years of age. A lot of teenagers simply don't bathe anymore. They take a shower. And this was something we assessed as part of the trial. And indeed, there was a preference overall of using the CLn Wash product, leaving it on the skin 1 to 2 minutes, as opposed to soaking in a tub with dilute bleach added to it. So this was very enlightening and really not surprising, because those of us who take care of pediatric patients, particularly those in the teenage realm, know that many of them are not bathers by that point in life. But what was most impressive was really meeting that primary endpoint, seeing the improvement in the EASI score, seeing the patients truly have an improved quality of life. Also, the patient satisfaction score for problem areas was noted to be improved as one of the secondary endpoints of this clinical trial.
What adverse effects of CLn BodyWash, if any, have been seen in clinical studies of pediatric patients?
Fortunately, in our clinical trial and also in my clinical experience, there were very few adverse events that made patients drop out of the study. Some patients did experience some mild warmth and tingling or burning on the skin, but this lasted only seconds or moments. and really did not diminish participation in the clinical trial overall. Few patients thought they experienced dryness and even flares of their atopic dermatitis as a result of using ClinWash. But again, the majority of the patients were maintained throughout the study, did very well, and saw marked improvement in their overall skin status relative to their moderate to severe atopic dermatitis as a result of clinical trial participation using ClinWash for daily bathing.
Are there indications outside of atopic dermatitis for which this cleanser could be recommended?
Absolutely. I would say in my clinical practice, I would certainly use this in patients where they tend to get colonized with staph in any form, whether it's really more of an abscess and it's recurrent. This tends to minimize transmission within the family. It also tends to reduce ongoing infections in patients, at least in my clinical experience. Also, folliculitis is another arena where I use this frequently. I have additionally used ClinWash in the realm of perianal strep infection, where I feel it can be a valuable concomitant therapy as I'm managing those patients with, let's say, topical and/or oral antibiotics to render them clear of that troublesome condition, which is also very uncomfortable for many of the patients who experience it. But there are a myriad of skin infections that I think can benefit from the use of ClinWash, particularly those involving superficial infections, broken skin surfaces, or even consider it in patients who are participating in contact sports. Maybe not so much during the COVID era, but as we get away from this time in our experience in the pandemic, we may see more patients going back into events where they wrestle or have contact sports. And to reduce transmission of bacteria from one participant to the other, a ClinWash bath after that direct contact in the sporting events may prove to be of benefit to the patients. We've certainly recommended it for that, though we haven't studied it in great detail.
Bleach bath therapy has often been recommended for treatment of pediatric patients with atopic dermatitis. How does this sodium hypochlorite body wash compare to bleach baths that are often recommended?
Well, I think there are some comparisons. Both improved patients enrolled in clinical trials. And while I was not one of the authors on the Northwestern trial, looking at dilute bleach baths and the outcomes, I think we did gain important insights within that trial. Certainly patients did improve in their overall atopic dermatitis status. They were allowed to use topical antibiotics during that clinical trial, but not in our current trial, which was published in Pediatric Dermatology in 2019. So what we learned from both trials is that we can embark on a therapy that is non-threatening to the patient, not expensive, easy to use. They can purchase it on their own. They don't need a prescription. They can either buy it directly from the company or even Amazon will carry these products. And patients can easily achieve better outcomes if they use this for their daily bath and help control their disease state with less intervention, perhaps from the physicians, even when they suffer from moderate to severe disease. Again, in the dilute bleach bath protocols, those patients also did improve, but keep in mind there were patients who received mupirocin as part of the therapy for that clinical trial published earlier than our trial.
Pediatric atopic dermatitis can often be stressful for the patient as well as their families. How could this treatment potentially impact AD patients with Staph aureus colonization and their families?
Well, certainly we want to be good stewards of antibiotic therapy as dermatologists. We don't want to keep these patients on ongoing antibiotics or even use intermittent antibiotics when we have an alternative therapy that's readily available, cost-effective, and really has been shown in clinical trials to reduce the severity of moderate to severe atopic dermatitis in patients who suffer with that disease state. And most parents are very amenable to something that they can use at home very easily. It's not threatening. We often compare using these agents to like going in a swimming pool at a hotel, although people aren't doing that right now because of COVID. Most people can associate that they have little fear of going into a public pool because they know it has either salt water in it or more likely chlorinated water in the pool that renders infection transmission much reduced as a function of that chemical ingredient being included in pool water. And by explaining this to parents, they really do accept and adopt this therapy for their child. And our patients have really enjoyed having something that does not require a prescription. Again, cost-effective, readily available, and they're already bathing anyway. So we're really simplifying their regimen, if you will, and bringing their disease state under better control.